This is the first, I think that the latest we've tried this time, haven't we? And in the hope that we would be able to help with sort of challenges that people might have on attendance, etc. But we will review obviously timings as we go on, so that we can make sure we're getting the optimum time to ensure we get the best attendance. Just to remind you that the meeting is recording, so that we can make it available to people to watch afterwards. And in fact, that might help somewhat, Richard, in the purpose of getting agreement to a number of things. We can obviously circulate the recording and make sure people are aware of the discussion that took place. We have had apologies from a number of governors, but probably only 6 or 7. So I think we would have expected a number more to attend. So people may have been held up or unable to attend and send their apologies. I just wanted to mention specifically that our non-executive director, Judith Seymour, has sent her apologies as she's currently on holiday. And I think that's all the director apologies. There are a number of other executive directors who weren't able to attend. I think that the key was Judith from a non-executive point of view. So we move on then to declarations of interest. As usual, the declaration of interest log is available, but I do just want to invite people to declare any interest for any specific items on this particular agenda. So I'll pause a moment to see if there's anybody who wants to make a declaration. Okay, none noted. Thank you very much. So minutes of the previous meeting. We do have minutes available of our meeting from May. So first of all, can I just check that everybody present believes they're an accurate reflection of the meeting that took place on the 12th of May? So any comments regarding accuracy? Okay, great. So everyone happy to support their approval then, and obviously we'll confirm that as part of the actions we follow up at the after the meeting. In terms of action log, I think the actions we've got on the log, which is paper C, are actually closed. So it's just if there are any matters arising that aren't covered in the action log that anyone wants to raise at this stage before we move on to the core agenda. Everyone happy with the actions and the minutes? Great. So without any further ado then, we're going to move on to the first main item of the agenda, which is the Director of Corporate Governance report. So on this, I will hand over to Fiona. Hopefully, Fiona, your microphone is working. Yes.
I have got back in the nick of time. That was very worrying, given that I've been on Teams all day, although probably people were quite excited with the thought that I actually was going to be silenced for a change. But anyway, don't be putting anything in the chat about that, please. So I'm going to skip through various bits of this, hopefully bring in a few governors to sort of join me in some of these elements, and also critically ask our external auditors, Grant Thornton, to lead us in one part of the report. So without further ado, I just wanted to welcome the 2 new representatives that will be coming on to the council. So Claudia is going to be the deputy for Sharon at the Reach Collaborative, because Sharon won't always be able to make the meetings, but it's really important that we do have that representation. And Claire O'Keefe is going to be taking over from Liz Fowler. So looking for Claire couldn't make it this meeting because she's on leave, but as soon as she's back, we're going to get her inducted and she'll be coming to the next meeting. She's really excited about joining us. On that note, we are going to be starting to look at attendance at the council. It is important that we have a really well attended council, and that just ensures that we have all views represented. So we're going to be reaching out to governors who whose attendance perhaps hasn't been as good as they had planned, and that we'd like to see how we can support them with their attendance. I want to let you know that we have had some applications in for our member and governor lead. We're just shortlisting that now, and I want to say a big thank you to Chris, Helen, Joanne and David, who've all put themselves forward to actually participate in our selection process. So thanks ever so much for that. Really looking forward to working with you guys on that. And on the next item, which is Ned and Chair Appraisal, I'm going to skip over that because that is mainly what we're going to be talking about in the private meeting. But just to say, we have made our submission on our Chair Appraisal to NHSEI by the deadline. So that is the thing that I just wanted to make sure that we got minuted in the public part of the meeting. I just want to reach out to any governors who, and there was quite a few of them, who attended the membership and representation workshop. It was a really positive and constructive meeting. I just wondered if anybody wanted to say a few words. We've obviously got quite a bit of detail about what we covered in the annex, but I just wondered if anybody wanted to just say a few words about how they found it, because I certainly found it a really good meeting. Is that Richard Amponza putting his hand up, or just potentially? No.
Yeah, sorry, I was looking for the. I'm taking this call on my phone. I haven't done that before, so I was looking for the button to.
Fastest finger first. That's what I saw. So no problem, Richard. You go for it.
Yeah, thank you, Fiona. I did find it really useful. I mean, given the fact that I'm new to all this, I've been trying to take it all in, but I think it provided a good platform to discuss the issues, and especially how to encourage and improve attendance. And one thing that I think we have said is we're going to reach out to members who clearly have signed up, but are for some reason not able to attend as much as we'd like them to, and just to find out how we can supportively encourage them to attend. So yeah, I found it really useful. Thank you.
Bless you. Thanks, Richard. I don't know if anybody else wants to say a few words. I know we've certainly got quite a few governors who were both on the call and at the meeting. I see Chris has put his hand up. Chris, over to you.
Yeah, hello. Good afternoon, everyone. Can you hear me okay? Yeah, good.
Perfect.
Yeah, it was a good meeting. We sort of pressed the reset button. I think it was a positive meeting in terms of the scope and our remit of representing members and members of the public, and a refresh in that work. One thing I would like to reference is the webinars, and as it says in the report, the number of people attending is lower than we'd hoped or expected, and I don't want this to come over too harshly, but this is a recurring theme for me, because I know, for example, the dementia event we had was good. The volunteering, we only had 6 people, 4 governors and 2 staff. And I know how stretched you are, Fiona, Richard, Tracy, Nikki in the FT office. And I wanted to help you with the wellbeing event that we had last week. And the members event coincided with the virtual wellbeing week for staff. And yes, I was co-presenting, I know that, but that wasn't my motivation, because I wanted to make sure we could promote this as far and wide across our 10,000 membership. Some things we do well, some things we do less well. And as a member, I didn't receive the summer edition of the bulletin together with a flyer advertising the event until 5 days before the event itself. And bearing in mind that only half of our 10,000 members are on email, the remaining 5,000 would have received that in post with probably just 1 or 2 days notice. And it's just frustrating, I think, that this is a recurring issue, certainly in my 4 years as a governor, that we can't quite nail this. And I'm making the plea on behalf of the members that they receive details of these events in a timely manner. we would not be giving staff 5 days notice of the virtual wellbeing festival. And I think both the dementia, the volunteering deserved a wider audience. And I know they can be watched back on our YouTube channel as a trust. But when I last look, the numbers for that wasn't as high as it could have been. So forgive me if this sounds a little bit blunt, but one of my jobs is to not only represent members, but to hold the board to account, the non-executive, to account. And I think as an outstanding trust, I believe that between us we could and should do better. This has been a recurring theme over my 4 years, and bearing in mind the time, staff and other volunteers are giving up to contribute and be involved in these events, I think we should really look at how we advertise them in a timely manner. Thank you.
Thanks, Chris. And obviously this is the first time that we've actually had a membership programme and a webinar programme. And obviously we in addition to putting things in the bulletin and in our email catch-ups, we do a lot of social media, and we do evaluate with comms how effective our reach has been. And I think that we've been unfortunate in terms of some of the timing of some things they've fallen in. So, for example, the dementia one, I think, fell in when we had half term. So I think they're all really good points. Let's take those away. We will always seek to improve. And I think your points are well made, Chris, and thank you for making them. I can't see any more hands up. I think so. I'm just going to kind of skip on.
Chris Oakes has.
Oh, I do apologise, Chris. I'm sorry, I did not see your hand. I do apologise.
I know. How could you miss me, Fiona?
I know. I don't know how I could miss you, actually.
No, I just want to pick up that, Chris. Thank you for that feedback. I think, clearly we do need to improve that. I think Fiona's said we can pick that up. So I'll make sure with the team that we look at that and think how we plan it moving forward. Because I think, as Fiona's saying, we're getting that moving, but I think as we start to move into it, we can get a clearer plan and get on top of that. So I'd just like to assure you about that.
Can I just say something? Just to say that I registered for the wellbeing event, and Tracy kindly sent me the join-in link. I think just again feedback. Reflective feedback is it's got to be as easy as possible for people to be able to join. Yeah, I sent that to all my team in dietetics, and I sent them the joining link so that if any of them did want to join, it was just easy. And so it's got to be easy for people. Yeah, because when I was joining, it wasn't straightforward trying to weave your way in. And so please have a look at that, reflect, and get an easier way forward. Because if you want to engage, access has got to be as easy as possible. Thank you.
I think that's a really good point, John, and thank you. I think we'll pick up these points with communications, and hopefully when we get our new member and governor lead in, that will be a key focus for them. Obviously, we've been managing everything else as well as the commitment that we've made to the membership programme. So I'm sorry if things have fallen a little bit short, but they're all really good points, and very, very happy to take that feedback. I just wondered if I might just actually come back to Chris, and wondered if he wanted to say anything about the Governor Focus Conference. I've heard really good reports about how that session went. So I didn't know, Chris, if you just wanted to say a couple of words about that before we move on.
Yeah, it was good. It was great to represent NHFT. It was good to come together with KGH. 18 months ago, Peter, Mabel and I got together as the prospective lead governor, deputy lead governor in Mabel's case, because we could see what was coming down the line with the development of integrated care systems. And as governors, we were keen to help our prospective councils understand better the governance arrangements for integrated care systems, the role of a governor in system working, and wider sort of public accountability obligations. And from that, with the help of the two trusts, with the help of colleagues on this call, we had those two workshops, one with the ICB chair, one with the ICB chief executive. And thankfully, the idea was put forward that we could promote this on a national stage as an example of good practice. So we did a few dry runs. We got there in the end. We only had a very limited window of 7 minutes, but it all went well, and it was well received both by NHS providers and also by other Council of Governors across the country. And the feedback we've had from NHS providers is that it has prompted and encouraged governors nationwide to have conversations. And I remember saying in the presentation that it all comes from one phone call. You know, just pick up the phone, talk to your colleague governors, because we have to think about system working as councils and as governors, not just, you know, organisations. But I would encourage you to look at the animated video. I'm so proud of that. It reflects a lot of the work. Richard Smith will know that I gave up a lot of time over the Easter time to put the bid and submission together. And the little 2-minute video is excellent. And it might be something to show at the AGM/APMM, because it really just brings to life the story behind working together and collaborative working. Thank you.
I think that's a great idea, Chris, and we'll certainly link in with NHS providers to see if we can use that video. Thanks for that. That's a fantastic idea. Just going to move on to the NED and governor meeting. Unfortunately, we just didn't have enough governors to actually have our planned Council of Governors and Board of Directors seminar. So we repurposed the meeting into a kind of quite a focused session with some governors that had indicated that they could attend and our non-execs. And I think we had a really good session, and I think that was followed up by the NED Governor Forum last week. And I just wanted to say, in terms of, I think that the governors did, we really listened to the governors about making some greater connections and providing more connections with them. We did put in the Friday comms last week that governors can get involved in place inspections. And I'm really pleased to say that Fiona Judge has already put her name forward to get involved in place inspections, because they're a great opportunity to actually see how things are working on the ground and get full briefing. There's a clear time commitment, but it's something that if you do have the capacity to do, I strongly encourage you to do it, because it's a fantastic window into how our services are running. I'm not sure if anybody has told us yet about whether or not you want to get involved in the training that we're arranging with NHS providers. But there is a Governwell course on recruitment and the governor role in non-exec appointments. Obviously, that's open to everybody, but we're particularly keen on any members of non-rem to attend that. And also the core skills course, we're looking at actually running that again this year for everybody. We'll probably even look to see if we might be able to run that with KGH in case they, to actually, I think when we learn together, we form relationships together. So let us know if you'd like to participate in that training. We will try and run it and link it to when we have newly elected governors. So I am going to ask my colleagues from Grant Thornton to help me with this next item, please. So we've got Andy Reid and Grant Patterson, both from Grant Thornton, and they, as you know, the governors were involved in the selection of our external auditors. This is our first year with the external auditors. Sorry, I'm just noticed that I've got a hand up from Joanne. Joanne, was it for the last item or was it for this item? Sorry,
no.
To see you.
Yeah, just very quickly for the last item. It's just to share that both Paul Kelly and myself attended the single point of access meeting. So again, it's all about services going forward and feedback. So Paul can share. He did some feedback from his carer governor perspective, and that was fed into the meeting. So again, more innovative examples of participation.
Thanks, Joanne. That's brilliant. Thank you for that, and we can get that recorded in the minutes. So back to Andy and Grant. So Grant Thornton are our new external auditors. So they have audited our annual report and accounts for 21-22, and they have certain duties to fulfil as our auditors. And whilst I'm not going to say any more, all I'm going to say is we have made a submission. We've reached the first timetable target. We submitted to NHSEI on time, but we still need some information from Grant Thornton in order to lay our annual report and accounts before Parliament, which we're now going to be doing after the recess. But I'm just going to hand over to Andy and Grant to just say a few more words and to introduce themselves as your selected external auditors.
Thank you, Fiona. And my name's Grant Patterson. I'm a director with Grant Thornton in the Birmingham office, and I'm I suppose what we would call the engagement lead for the external audit for the trust, as Fiona has alluded to. And Andy Reid, who is also on the call, is a senior manager within the practice, and he leads on the day-to-day running of the audit in terms of delivery of outputs, etc., for as required under the Code of Audit Practice by the NAO. I don't know if anyone wants to turn his camera on and say hello. You can just say hello.
Hello, camera is on. If I say hello,
I think we can see Andy. Yeah.
Screen.
Oh, there he is. Right. Okay. So
evening, everyone. Hello.
And I think the reason Fiona is asked us to attend today is one because as part of the tender, we did say we'd look to be engaged more with governors, and that, I mean, most of us assumed at the time of tendering that we wouldn't be continuing a pandemic and we'd be able to engage a bit more sort of face to face. And part of that is, as alluded to, there are specific roles and responsibilities for ourselves as auditors. So in summary terms, in terms of, I suppose in simplistic terms, two main reports come from us to the trust. One is our audit findings report, and that is actually summarising our work in relation to the statement of accounts audit. So that's the sort of financial outturn effectively of the trust, and we report to audit committee on that under delegated arrangements. And the other document is what's called the auditor's annual report, and that summarises our work in relation to value for money. So in terms of the statement of accounts, as was alluded to, we did issue our audit unqualified audit opinion on the financial statements on the 21st of June, and that was in line with the national timeline and national timetable, and therefore the trust was able to submit its accounts in line with the national timetable. In terms of what we also have to do as auditors is complete our work on value for money, and that has been delayed, and I'll come on to the reasons behind that. And the reason that is important is because it's sort of technical, I suppose, in the way what I have to do on the account is I have to certify the audit closed, and then that certificate needs to go within your annual report. And I cannot certify the audit closed until I've completed value for money work. Now, we did originally plan to have that work completed alongside our work on the annual accounts. And we commissioned, and as part of as a firm, we have a specialist value for money unit, and we had one of our specialists aligned to do the work. Unfortunately, that individual is off on long-term sickness, and that's delayed our work in relation to the value for money audit. And I explained the reasoning behind that to the audit committee back in June, and I've written to the chief executive explaining it. Now, clearly that isn't a position as a firm that we'd ideally wish to be in, and we've taken steps to try and pick up the delay as best we can, and we've got another specialist who's now working alongside us, and Andy's been picking up elements as well, and we have agreed a revised timetable where our draft report should be with the trust by the 21st of July, with the aim to report to board on the 28th of July. The implication, what that does mean is, and I know, and we pass on our apologies for that, in terms of it means that in terms of yourselves getting your annual report into Parliament, there are various tranches, and the trust has always hit tranche 1, which effectively the opening date for that was the 1st of July, and the closing date was the 8th of July. So we were unable to complete our work in times for that, because I need to go through certain quality checks to make sure that what we report to you is appropriate, and we consulted with management before we do that. So the revised timeline does enable us to work with the trust to submit for tranche 2, which happens over the summer, and then also hopefully that will be laid with Parliament on the first day it comes back. It is quite a tight timeline for the annual public meeting, is about 7 days after that. But if it gets laid, then everything should hopefully slot into place around that. And I say we've been in discussion with Fiona as your governance lead, but also Richard Wheeler as Director of Finance in relation to the trust. And as I said, I did write to the Chief Executive explaining and our apologies in relation to that. And part of that was to come and speak to yourself to explain why we are where we are, what we've set in place to correct that. So hence we are in that work, and I will be receiving a first draft of that report tomorrow to review, and then we're going to discuss an early draft of that with Fiona and Richard on Monday, and then hopefully circulate it to the trust later in the week. So we're online with that timeline. And also what I have agreed to do is, if it would be helpful to the trust, is to write a separate email to the parliamentary clerk explaining that the reason why you haven't met tranche 1 is nothing to do with the trust arrangement. It's to do with the fact of we've had this long-term sickness, and basically whilst we've been able to rearrange resources to pick it up, I couldn't immediately rearrange it quick enough that we could hit the tranche 1. So we just want to make clear to the parliamentary clerk before they hit recess that it's to do with us and rather than yourselves, because I mean what we've had to do is over the last sort of 10 days or so we've reproduced a couple of meetings that were held originally, and we've updated our workbook, so we are in a position where we're close to be able to sort of issue our report. It's not ideal, I recognise that, but we have put the resources back within that, and I'm sure that next year I hope we won't be in the same place, and we will be able to close down it in line with the timelines. But I'm here today to explain where we are, and I don't know if Andy's got more of an update than that, but I'm happy to take questions. So we are working with the trust. I'm expressing my apologies for that we haven't been able to hit that timeline of it. We did try and manage that. It's not my, I'm afraid it was out of my control. We have a plan B in place, and we are on track to that, and we should be meeting that next week. So
thanks for that, Grant. Andy, I don't know if you wanted to say anything before I bring Joanne in.
Yeah, just briefly, just to confirm, as Grant said, we've been working over the last week or so closely with Fiona and other directors just to make sure we've got everything we need, because unfortunately with our member of staff going off on sick, we've had a few gaps to backfill on that. I think we're pretty much there now in terms of compiling the evidence, having the interviews and pulling it all together. So the work is effectively now complete. As Grant says, we're in the process of drafting the report. He'll be able to see that tomorrow, and we've got a call set up with Fiona and Richard on Monday to go through the findings. So I think we're pretty much there in terms of completing the work now.
Yeah.
Great, thanks, Andy. Joanne?
Yeah, I just want to ask a question. Again, it's just to make, I'm going there on Saturday to that building. So I just want to ask the question and make sure that in terms of the parliamentary clerk, then because of the time scale of the public meeting, have we got assurance that the parliamentary clerk will not be on annual leave when you're submitting that? So because we do not want anything to jeopardise, the process going forward with the public meeting.
No, absolutely. So that's something that we're doing behind the scenes, Joanne. We every year we have to liaise with the parliamentary clerk's office, and obviously we will be pulling out all the stops and to make sure that our annual report is one of the first ones that gets considered after recess, so we can get it up on our website and make it publicly available. So, or if I can ask everybody to kind of collectively cross their fingers, toes and everything to make sure that we do manage to kind of pull this up and it's in time for our annual members meeting. I'm confident that it will be. It's very unfortunate, but that is unfortunately where we are. Sickness unfortunately happens. John, did you want to come back in? I see you. Oh, you haven't. I think it's
the only thing I'd probably add to that is by getting it done, I think by the end of July, effectively, our hope is that you'll be at the front of the queue for tranche 2 almost. You'll be one of the first submitting because tranche 2 closes a lot later. But I think the idea is if it goes in at the end of July alongside either an email from us or a letter, we're talking to Fiona and Richard about how the best way of doing that, then you should be at the front of the queue. And I don't know how it works, but I would hope that they have some way that they stick it on the website, if you know what I mean, and it sits there and then it automatically gets published as soon as it comes back. But I honestly don't know how Parliament works, and that's the uncertainty behind that. So.
Thanks for that, Grant. I see we've got a couple of hands up, I think, Helen and Richard. So Helen first, then Richard Wheeler, please.
Yeah, just two brief ones, I guess. The first one is to say, what is the risk to the AGM if the report doesn't get in the right place in the queue? As in, could we have the meeting without the report, or would we have to be cancelling and rescheduling the annual meeting? And if so, should we be making a plan B arrangement now for that? So that's the first one. And the second one is really, obviously, sickness you can never foretell. But I'm just interested to understand what Grant Thornton's planning is for mitigating single point of failure in the future.
I can't really answer the first one. I think we've had conversations. I mean, in terms of, I think it has to be in front of Parliament. I think for you to be able to lay that. I mean, I'm sure. I mean, it's just a risk. I mean, I can't believe that Parliament would question it in any way. If you know what I mean, I can't believe it would change anything. So I think we're just liaising with Fiona. I'm not quite sure what the legislative background is. I don't think there will be a risk to you in terms of. Well, I don't think I've ever known Parliament change an annual report on accounts or challenge it in any way. So I don't know about that. In terms of what we are doing to mitigate as a firm, we are growing the VFM team as a whole. To be honest, we're investing in that. We're recruiting more people, so that team should be bigger basically next year, which will give us greater resilience. It's not. And within the team, it's like Andy as a senior manager does have the skills and knowledge to be able to undertake the value for money work. It's just that we try to separate it out to try and develop, I suppose, the expertise, but also make sure that Andy can focus on the audit work as well, so we get that done as well. So we are effectively investing in the team, so we will have a much bigger VFM team next year, and therefore I think that will give us greater resilience in terms of being able to move resources around should it be required. I mean, and hopefully we don't enter that position again. But I think it was just the team. I suppose we've only set it up as a separate team 3 or 4 months ago in terms of separating it out. So at the moment it's a relatively small team, but it is growing significantly. So we are growing that resilience going forward and to mitigate this type of thing happening again. So.
I'm just going to bring in Richard with his comment, and then we'll circle back round and close this item. Richard?
Oh, yeah, good evening. I'm Richard Wheeler. I'm the Finance Director, as Grant was saying. So Fiona and I have talked with Dion Mayhew, our Director of Communications. She's our expert in this area. We have already submitted a draft of the information that is laid before Parliament. So there's a couple of stages to this. One is submitting a draft, and as people have said, liaising with the parliamentary clerk around that. So that first stage has been undertaken, and we haven't received any kind of feedback on that. And then obviously the second stage is the final version being approved. So we're already in that kind of 2-stage process. Obviously Parliament recesses for summer, hence why there's a couple of tranches there. But you're right, Helen. There is, there is a small risk remaining. If something were to go awry, then I think it is, difficult. But we've set out all the steps, and Grant's obviously supporting that as well in terms of clarifying the arrangements. So we don't believe there's anything further that we can do, but obviously we'll work closely with Dion and Grant and his team to manage that.
Yeah, thank you. Thanks, Richard. And I'm confident that we will have the report laid before Parliament in good time for our annual members meeting. So I've got every confidence in that. And if we have to, we will also speak to the regional team about it, because as Grant says, and as Richard has echoed, we have already produced the report. It's just that we haven't finalised it with the auditor's certificate, so it's actually already been received by Parliament. So I've got every confidence that we'll meet the timetable. So I'm going to just wrap that item up, but just actually smoothly segue into the annual members meeting. I'm conscious that I need to start wrapping this whole section up, and I just wanted to say I'm really excited at the programme. And obviously we shaped the programme again, responding to feedback from the governors, we've started the whole process a lot earlier. We had a good outline agenda for our annual members meeting. We shaped that up a little bit with governor input and with input from Audit and Comms and Anne Linsell, who helped us with our first meeting. We're planning to have another video with the governors this year. I'm really pleased that Carol, Joanne and Helen have already come forward to star in the video, and we were hoping that we'd be able to do it at a professional studio. We'll have to see what COVID is doing at the time that we need to do the filming, but I'm really looking forward to it. Theme is compassion and kindness, and I think we've got some great ideas of how we can actually how we can work with governors on that. I want to completely again, I think it was Joanne that made the point about making it as straightforward and as for people as possible. We will do whatever you need. We will script stuff for you. We will work with you in terms of working out what you want to say, how you want to say it. We'll fully support you. We just want as many governor faces and voices on our video as possible. And again, Helen and Joanne, I know, are sort of are again on hand to help demystify, debunk, and so on. And looking forward to kind of even more of you coming forward to actually to appear on our video. I am just going to say again, thanks to Helen, Carol and David, who've already come forward for the review of the Annex 6 of our Constitution. Again, looking to involve governors fully in that. Peter Howie, who has previously been Director of Corporate Governance and Trust Secretary at Lincolnshire. He's just recently retired. He's on holiday at the moment. He's very disappointed that he can't be with us today, but he is planning to watch this council meeting on catch up. We will be starting work with him in mid-August. So for various reasons, we can't start before mid-August. But as soon as you all put your names forward, we can make sure that you get to know him and you get involved in this work from a very early stage, because we are committed to learning lessons from the process and looking at actually how we can manage these matters with appropriate support for governors involved in the process, and making sure that we make things as easy and as streamlined as possible. The consultation is closed on the 3 key governance documents that NHS England and Improvement issued. We have, as a trust, submitted a response to that. And I propose that we do a little bit of work with the council when and we'll also do it with the board too, when those documents are actually finalised, and we can look at actually what changes we need to make. There are a number of changes, improvements, additions, but again, I think we're in a good position to be able to respond to those, partly because of the work that we've done, looking into the background and looking at the draft documents. The quality account indicator that you selected will be bringing the report back on that in September. So I didn't want you to think that we've forgotten about that. We'll be bringing that report back in September with the progress that the report itself and the progress that we're making on it. And again, the effectiveness review of the Council of Governors, we've had a great response, some fantastic feedback, lots of very, very interesting scores, very positive scores. I'm not sure we've had many people come forward from the governor community to help us really dissect those comments and those scores and look at actually what we can do differently. As you know, we've been trying out new things, times of days and meetings, different types of meetings. Attendance is the thing that is causing me a little bit of concern at the moment. What do we need to do to maximise attendance at all of our meetings? So we've had some really good suggestions from people, but again, please come forward to get involved in that, in those effectiveness reviews. I can see Chris has got his hand up. Chris, can I come to you?
Yeah, thank you very much, Fiona. Just on those 2 points, I was going to think I could offer to help encourage some governor interest in these 2 important areas. I think certainly in terms of the Annex 6 of the Trust Constitution, the Governor Concordat, I know I can speak on behalf of my colleague governors in that we welcome that review and the commitment to involve governors and NEDs in this important piece of work, and I would encourage my governor colleagues who want to be involved in that to express an interest in contributing, and I will write out to perhaps encourage and prompt some governors to do that. And equally for the effectiveness review, you know, thank you to the governors who did contribute. I think it was 16 I read in the report. That, you know, that was pretty good.
Really good, yeah.
You know, in terms of, you know, nearly half of the council who did that. And particularly thanks to Paul Kelly, who helped put those questions together. And as you say, Fiona, what's working well, what can we improve? And I thank you too for the commitment to involve governors in the review and analysis of the findings together with our NED colleagues. And again, I would encourage governor colleagues who wish to be involved to let the office know, but I will write out as lead governor just to prompt some interest, and particularly those governors who couldn't make it today.
That's brilliant, Chris. Thank you. That'd be great. I'm very grateful for your support. So that's really the end of my report. I forgot to say on the annual report and accounts in the APMM item, I've already had commitment from Grant and from Grant Thornton and from Sakib as our new audit chair, that they will also be, I mean, Grant Thornton will obviously be participant in the actual APMM itself, but they've offered to do a little video for us about kind of what they look for as auditors. So again, if governors want to submit some questions about what you'd want us to cover on that, really, really keen to work with you. And Grant Thornton are very committed to working with the governors. And Sakib has also kindly agreed to be featured as audit committee chair. What does he look for in an annual report and accounts? And I can see Helen's got her hand up, and then we'll take Helen's question or comment, and then I'll hand back over to Krishna. Thank you.
It's just a very quick comment, kind of following on from Chris, but about the APMM AGM meeting. It really is just a reminder and a sort of a request really for any governor who'd like to take part in being filmed, but it could be any size segment, could be a couple of seconds, could be a couple of minutes, talking about the 4 themes that we have put in the paper from Fiona. So you don't have to know what you need to say before saying yes to being filmed. And I am the least photogenic person in the world, and I'm going to give it a go. So I would encourage any governor who would like to contribute and get involved, a little bit like a sort of talking heads piece, which just gives everybody at the meeting a bit of an insight into us as governors, what we've been doing and what we think about what we've been doing. So I think it's a great opportunity. Thank you.
Perfect. Thanks ever so much, Helen. Back over to you, Krishna.
Great, thank you, Fiona. That was a really comprehensive report, and good to hear about all the progress that's been made and the discussions people have been involved in. Thank you to governors who contributed to that item, and also, of course, Andy and Grant for joining us for this item. And so, you know, quick reminder, I think, just to say there's lots of things that you can clearly get yourself involved in. You know, Helen's highlighted the video, which it sounds fantastic opportunity, and then certainly the Council of Governors Effectiveness Review, the Annex 6 Concordat and Concordat Review, but also the opportunity to attend some training as well. So really welcome your participation in all those opportunities. And just to note, as we conclude that item, that during the course of that item, we did become quorate, I believe, Richard, so unless that's changed, so that we probably had a few people who are just a little bit late, but I believe we're quorate. So unless that changes at some point through the meeting, we should be able to conclude any decisions we need to today. So I'm delighted now to move on to one of the items I think we introduced last time on our council meeting for the on the first occasion, and that was an opportunity for one of our staff governors, but in future it could be, you know, perhaps a carer governor or a partner governor. And, you know, it doesn't need to be restricted to staff governors, but I think it's a great opportunity, particularly because of the pandemic and the challenges that that has posed for us as an organisation, but the NHS generally and colleagues around our partners as well, to hear from staff about things that have been their insights really into and experiences. So really delighted that we somehow managed to convince Richard, even though he's still quite a new governor himself, to come along and share his story with us today. So Richard, if you're ready to go, I'll hand over to you, and I think we've got 10 minutes or so to hear from you, and perhaps an opportunity for some questions as well, if that's all right.
Okay, thank you, Christy. So I'm told it's 10 minutes, 5 for my, quick, who am I, and then 5 for questions. So yeah. Right, so my name is Richard Amponsa. I'm originally from Ghana. I've lived in the UK since 2001. I first came here in 1990 to visit my dad. Went back, and I've been kind of doing back and forth. I would come here on holidays to do some work, as a student in Ghana on holiday. I came into nursing as a matured student, having previously completed university in Ghana, where I worked in the French hotel chain Novotel. Really, there was a lack of career progression opportunities because if you didn't speak French, the prospects weren't that great, and I just couldn't be bothered to pick up another language. So I was exploring other opportunities, and a friend of mine advised me to look into nursing, which I did. So I applied to the University of Hertfordshire, and I completed my nursing training there in 2004. And then I worked at the Queen Elizabeth II Hospital in Welwyn Garden City for about 18 months and started working with the trust in February 2006, and haven't looked back since. One experience that I had, you don't realize how much you've changed until you actually go back to your home country. And one thing Ghanaians are, we do things informally. So like somebody would come and visit, they wouldn't necessarily tell you you're coming. They'll just turn up, and if you're there, you're there. So on one occasion, my wife and I went to Ghana on holiday. We're sitting in her parents' lounge, and then somebody knocks on the door. And I leaned over to my wife to ask whether this person told us they were coming. And she just burst out laughing. She said, "Richard, you've been in England too long. Since when did anyone tell you they were coming to visit you? They just turn up." So this person turned up, we had a good chat, and then they went away. And I'm just thinking, in terms of nursing and how we look after one another, we have, mental health hospitals and such like in Ghana, but care is organized very informally. So it's more resting on the family. They don't necessarily call themselves carers, but they do care for one another. And I think we could infuse a bit of that into the way we do things here. So just looking out for one another, looking out for people, and just asking, how are you? And, meaning it as if you want to elicit a response, not just as a courtesy. So that's one of the things that we do that, I think, I try to infuse it in my working life. And, we have meetings, and I'll go behind the scenes and call somebody and just have a chat, see how they are and how I can support them or how they can support me. So that's me. I'm currently working as the interim head of crisis care and criminal justice. So there are 2 strands to my job. There's the crisis care element, and then there's the criminal justice. So basically, the pathways within the services within the pathways are the Integrated Response Hub, which is based in Rushden, which the trust started in March 2020. And then we have the crisis cafes, of which there are 6, and Corby, Kettering, Wellingborough, Rushden, Daventry, Northampton. I think I've touched on all 6. They are not 24/7, but at any point there are at least 2, sometimes 3 open, and they're open till late. And it's a collaborative between us and the Charity Mind. So it's a collaborative effort. And then we have a mental health hospital at home, which we use as an alternative to hospital, of course, based on how manageable the risks are. Us and our partners from Mind will actually go and be with people in their homes just to support them instead of them going into hospital. And then we have the crisis houses in Rushden and Rushden, the Martins, and then we have one in Northampton called the Warren. And again, that is just for anyone. You don't have to have a mental health diagnosis. We take referrals from within our services, and people can stay for, on paper, up to 7 days, and they'll get help with anything from signposting to brief solution-focused work, anything that gets them over the crisis to help them to get back into the community to carry on with their lives. And then we have the Acute Liaison mental health services, which are based within the acute hospitals in NGH and KGH. So we look at assessments and signposting and putting people into hospital, and sometimes having to call for mental health assessment and unfortunately having to detain people against their will if needed. And we also reach into the wards. So if somebody comes into hospital, the initial complaints may not necessarily have included mental illness, but if in the course of their stay there are concerns, they can refer to us, and then we will go and do some in-reaching. And then we have the police liaison and triage car service, which is based in the force control room in Mereway in Northampton. So we actually go out with the police to respond to incidents in the community, and we have the opportunity then to carry out mental health assessments in the moment whilst the police are dealing with any other issues. I haven't managed to get myself in one of those cars yet, but I'm looking forward to it with all those flashing blue lights in there. And then we have the custody care, which is based within the police custody suites in Bracknells in Northampton and in Weekly Woods in Kettering. So again, we have our nurses there. Anyone who's arrested and brought into custody is offered a mental health assessment, and how can we support with the mental health. So we want to make sure that every stage we have somebody there to handhold and to guide and to support as needed. And then we have the liaison and diversion team, which will work with people through the criminal justice system. So sometimes people's offending is what's the word I'm looking for, is contributed to by some kind of illness, and we want to make sure that whilst you're going through the criminal justice system, we're also on hand to provide any mental health support or care that you may be in need of. Well, what is a typical day like for me is getting updates from our operational leads in our various services, person staffing issues, and just supporting my managers and frontline staff to provide the best possible care for our service users. I kind of see my role as similar to an orchestra conductor. I may not necessarily know how to play all the instruments. I may not know how to play the flute or the cello or the violin, but my duty is to make sure that those who play the instruments have everything they need, whether it's training, whether it's the right equipment, so that together, playing together, we can produce, hopefully, some good harmonious melodies for our service users. So that's how I kind of see my role. The most challenging part of my role, I would say, is when I get an influx of telephone calls, emails, and the like from our acute care colleagues saying, Richard, move your patients out of my beds. And I'm thinking, the last time I checked, I think the beds were full. Everyone in the county, they're not necessarily your beds. But, I understand your frustration, because when somebody is not deemed to require any physical health input, they want them out into psychiatric beds if that is what the need is. But I think we all know that as a county, actually as a region, and we're facing some kind of a crisis in terms of beds. So it's about walking with them and working with them and trying to reassure them. And the thing is, they won't go to the places where they can get the ready answers. They'll come to me, or maybe sometimes they go to Adam Smith, my manager, and Adam will come back to me and say, Richard, can you help these people? And then, so it's just trying to encourage them to go back to the source. The people on the ground, they actually know, I'm just going to take the information from them and give it to you. So if you went to them, they'll probably tell you and give you more reliable information. But sometimes they feel like maybe escalating would help them to get to where they need to go a lot quicker. What's new? The one thing that I am very proud of with this trust is we have a proven track record for introducing new things. So we are trusted to introduce new services and things that we've talked about, the crisis cafes, the crisis houses. You go in places and people ask, oh, I didn't even know this existed. How does it work? And so we are trusted like that. So because of that, we've been given some money to start a mental health ambulance project. So we've commissioned 2 ambulances, and they'll be working based. One will serve the north of the county, the other one will serve the south of the county. We'll have a band 7 clinical lead who is a non-medical prescriber, so they can prescribe kind of low-level medication as needed. And we intend that they will be big enough to be able to provide some kind of physical, restraint if needed, always as a last resort. But yes, those 2 ambulances have been commissioned. We've got the QIA signed, and we're going to go and recruit. And more importantly, we'll be involving people who have had some kind of, lived experience within mental health services. I mean, NHFT is big on co-production, and that's something that we're really proud of. Another new thing is a service called Reconnect. So we are in the process of signing up to that. Again, the funding has been approved, and it's basically a service that seeks to support people who are leaving prison. So 12 weeks before they leave and up to 28 weeks after they've left prison. We want to work with them to make sure that their integration back into society is as smooth as possible. It's not just health, it's, all the other social issues, housing, benefits, the lot. So we're just there to make sure that these people have as soft a landing as possible, and it's all with the idea of trying to hopefully prevent reoffending and them getting back into prison. So that is what is new. I think I've done 5 minutes, so I will keep quiet and invite questions if anyone has any.
Thank you, Richard. Well, you may have missed the fact that whilst you were speaking, your hands were going up with people wanting to engage and find out more. That was a brilliant snapshot, I think, of our range of mental health services, kind of really explained in very simple terms, and really, really helpful. So I know there are some questions, so I'll bring some people in to raise those with you. So first of all, David Jones.
Thanks, Krishni, and thank you, Richard. That I really learned a lot from that, and it was impressive to hear. Mental health in criminal justice is such a huge issue. So many people in prisons and in criminal justice have got mental health problems of all different levels, which are often not recognised. Do you know how, difficult perhaps to say, but how we compare with other parts of the country in terms of diverting people from the criminal justice system, or the number of people with mental health issues that get caught up in police procedures? Difficult to measure, but...
Yeah. I don't have absolute numbers. I know, for example, that Northamptonshire Police, who are close collaborators, recently launched what they call TAC, which is trauma-informed care for trauma-affected children. And apparently they have about 70 of every 1,000 people that are arrested are children. And there's recognition that some of these children may have had challenges in terms of growing up, and there might be existing trauma. So the last thing we want to do is to, exacerbate it. So it's about providing trauma-informed care in a way that doesn't exacerbate what is already going on. But I think in terms of the number, from going just by anecdotally from the conferences and the workshops that I attend, it looks like we are kind of far ahead in terms of, some of these innovations.
It's good. Thank you.
Thank you, Richard. I know actually just from trying to think, it's Positive Practice in Mental Health, who I think are a sort of independent advocate for, mental health, quality improvement and mental health services. Actually, I was really delighted to see, Richard, that I think he had met the gentleman who is involved in that, had recently met with Adam Smith and other colleagues, and he actually tweeted very excitedly about the quality of our services and how he felt that we were sort of really promoting good practice in mental health. So I thought that was really positive, because it was unprompted, and really just this gentleman tweeting out how excited he was to hear about what we were doing. So I'm not suggesting we're miles ahead of anybody, just it was good to hear that we had, that good practice, that and the innovation that I think Richard highlighted was recognised by him. So that was really positive. Thank you very much for your question, David. I'll just bring in a couple of other governors, and then I know Scott and Julie want to come in too. So over to Chris next. Chris Davison.
Yep, thank you, Krishni. Can you hear me okay, everyone?
Yeah.
Richard, knowing you as I do, you won't do this, but take a bow, my friend. Take a bow. I salute and applaud you for all of those, innovations, the work that you're doing, as you said, at leading the orchestra. And I think it did give a good insight. And wouldn't it be interesting to show this to the public? Because let's be clear, the public think the NHS is A&Es and theatres and doctors and nurses. And yet the vast range of innovative ideas, the crisis cafes, Catering Minds included in that as well, and the work here in the north of the county around the custody suites, particularly not just dealing with, the reasons for crime, but the causes of it, the trauma, around particularly children. And that, I think, really should be sung from the rooftops. And I know you won't say this because it is the team and the team below you and the way you engender that support. I just really wanted to say well done, really well done on behalf of the council. I think we should acknowledge the work that goes on. I always remember when I first became a governor that NHFT was the third largest provider of prison healthcare services in the country. Doesn't always get, in the public psyche, the recognition it deserves. But from all of the work you're doing through to this, marvellous sort of Reconnect scheme and the mental health ambulances, the police cars and the triage. I spoke to one of the police last year at a public-facing community engagement event because I had the NHFT stall, and she was absolutely saying how important it is. So there's some feedback from, a member of the police force. But thank you again, Richard, and sparing your blushes. Well done.
Thank you, Chris. Thank you. So Joanne next, and then we'll bring the Neds in and then close. Joanne?
Yeah, thank you. It's fascinating, Richard. Just wanted to pick up on the point about the challenge of sort of like reintegration and the housing, and the supporting the integration. So, are you connected with Hope in Action? So the project Hope in Action, it's here in Peterborough by Ed. Hope in Action. It's all about housing. Are you connected with that, or?
Their name doesn't ring a bell, but we're in touch with. We recently organised a homelessness event in Kettering Park Hotel that attracted so many other players. And I think one of the challenges of the work we do is that so many people are doing a lot of good work, but in silos. And we just need to close the gap and get to know one another. So that was a very good platform for getting to know one another and exchanging ideas and just, even sharing our contact details, for example. So somebody knows if I'm in a bind about somebody who I think has mental health issues, I can call Richard or I can call, whoever. So we're working on that.
I can certainly send you the information because it's really developed in this area. Yeah.
Great.
Thank you.
Thank you very much, Joanne. That's a great suggestion. Right, quick comments from Scott and then Julia, and then I think we'll need to bring the item to a close.
Yeah. Okay. Thank you, Krishni. Richard, just wanted to, add my thanks to the others that have already said thank you to you. I mean, I think you delivered that with, a real degree of confidence and some style as well, Richard. I feel considerably better informed as a result of that, and I enjoyed listening to it as we were going. Just as a passing comment, incidentally, my wife runs a vehicle fleet for Northamptonshire Police, so typically getting into police cars isn't the difficult bit, it's getting back out again that isn't the easy bit. What I would say, hopefully on a more constructive basis, right, is that recently, just at last week's performance committee, we had your colleague that you mentioned, and he's had a few name checks now, Adam Smith, along as part of a sort of deep diving presentation that was set up by David Mayer and Anne Rackham. And absolutely, just like we've just heard folks from Richard here, they were fantastic, absolutely excellent when they came in. They were enthusiastic, exceptionally well informed on top of every aspect of detail, and constantly innovating, and you could see that in the way that they were driving through and every aspect of what they were bringing forward. The only shame in it all, unfortunately, was that we ran out of time in the session, and we could still be talking to them now because it was so sort of intriguing and engaging. So I just wanted to feed that back to colleagues and to thank David, who I know is on the call, for setting it up, because it was a really valuable aspect to the session. And thanks once again, Richard.
Thank you, Scott. I'll bring Julia in now, and then we do need to close this item. Thank you, Julia.
I'll be quick, Krishni. Thank you, Richard. Absolutely amazing. I could listen to you all day. I think you're so engaging, and you're an absolute advocate for your services. So absolutely brilliant. Thank you. Just to say, you started by talking to us about informal networks and ways of caring, and then you gave us a whole load of examples of where that's happening, like your cafes, etc. So I thank you for that. And I had the privilege to be partly involved in the performance committee session last week, and then this morning the quality committee actually heard from some of the children's CAMS staff and talked about their paediatric young people's crisis cafes, etc. So my question was going to be, before this morning, I would have asked you, do you overlap with the children's teams, and do you have similar services? But we heard this morning absolutely that they're replicated, and some of the challenges are across both services. But so really a huge thank you, and I know you're linking with others across the trust, and long may you continue to have a huge impact on people's lives like you are now. So thanks very much.
Thank you, Julia.
Thank you, Richard. So I think there's lots of really positive comments, Richard, and feedback in the chat. So I think I'll leave you to read that at your leisure. But I just wanted to comment that Richard was actually one of the first members of staff. I don't know if you remember, Richard, that I met even before I started. So he was actually involved on my interview day, I remember really well, and showed me round and talked to me a lot during the day. So that was really interesting. And I thought actually the comments you made at the beginning were a really good illustration of the theme of our AGM, APMM, and indeed the leadership session tomorrow, which is compassion and kindness, because that's, I think, what you were trying to epitomise in the comments you were making. So thank you so much, Richard. Really insightful. Now we do need to move on because we're a little bit behind time, and I'm going to need to skip our break. But I will give you a break, hopefully, if we can crack through a little bit more of the agenda, and then we'll be able to take a short break before our private meeting. But I will, at this stage, I think we're moving on to our strategy and assurance section. And you will note that there are reports from the board reports from myself and Angela as Chief Executive available to you. But actually, we have Angela here, and I think I saw Dave here as well. So I'll, at this point, just hand you over to Angela. Angela, if you want to say, can highlight anything that you particularly want to draw Governor's attention to. Thank you.
Thanks, Krishni, and as we've done before, really just a great opportunity to share some of the, we always pick 3 areas that I think are particularly occupying time and share that really. The first one is staff, and in many ways, and I think obviously we've talked about that before in terms of the pressures on staff and the demands on staff, and we're still in a pandemic, albeit that we may have a lower level of incident, but the demands are pretty challenging, and that's because we've seen increased demand in many of our services. We've got staff, with their own personal stories and experiences, and of course we are now moving much more into the NHS trying to recover, as you'd expect, and the productivity challenges and everything that goes with that are upon us. So there is a big staffing component. In addition to that, as part of the staffing bundle, we've also got, some people will know and won't need me to tell them, the sort of challenges of cost of living. And that is pretty significant. Now, significant for our population, but it's very significant for our staff too. And, many members of the team have been working on how we can work with staff side colleagues and others to think about ways to support staff. There's been lots of examples. Richard Weir did a lot of analysis around mileage, the impact on petrol for staff. We took steps as a trust to support staff differently through that. We didn't get movement on a national basis around mileage rates, but we've taken steps nevertheless to support staff. And we continue to look at ways in which we can support people. And but it wouldn't be right if I didn't mention that, because it is significant. And whilst there are lots of people and lots of people in different experiences, we have got people who are very much challenged themselves in that situation, and we're encouraging people to talk about that, as you'd expect, and to support them accordingly. In addition to that, the staffing one is around the whole recruitment, retention, the whole gambit of things that we know are pretty much part of our everyday world, but also all of these things mesh together. So right and proper that I talk about staffing. And of course, we're living with COVID, and again, we mention it most times, but again, we're seeing increases in that rate in our communities. So we've just had to move towards our mask wearing again across the trust. So those sorts of things affect staff, of course, and I know governors know that. The other thing that I wanted to mention, some really positive news, and we can spend more time with this on another occasion, but people recall that we've done a lot of work in our mental health and disability and autism collaborative, and we are one of the first in the country, I think, to have got it to the maturity that it is at, and that's down to key colleagues from Richard's directorate, but also from across the organisation, in particular Anne Rackham and Morgan Price, who've supported us to really take this transformation forward. And it's took many years of partnership working. This is not something that's been a quick fix by any means, but what I'm pleased to say is that Toby Sanders, the Integrated Care Board Chief Executive, myself, did sign a contract for us to be a lead provider. And that's really significant for our population, it's significant for us, and it's significant for our voluntary community sector, because we're now in a position in our tranche one to be commissioning those colleagues and are supported to do so. There's a lot of work that goes behind all that, not that we'll go into that now, but it's a really significant step, and I think the Integrated Care Board is looking to announce that and to really sort of profile the work that has been done in this space. But I'd want to formally thank everybody who's been involved in that. And then the other one that I wanted to mention, of course, is that we are now in, an official integrated care system. So the 1st of July marked the moment, and of course, whilst we've been meeting in shadow form, we are now a statutory basis integrated care system, and that means Integrated Care Board. I'm now officially the voting member on that board, and that means that we are adapting and adopting to that environment, quite rightly. We seize and welcome the opportunity to be an integrated care system, and we're already, as the Mental Health Collaborative illustrates, working in partnership to a great degree, but this will give us more opportunity, and Richard Wheeler, I'm sure, will be able to describe the way in which finance colleagues are looking at how we can approach risk together, how we can think about looking at resources together. This is challenging stuff, but nevertheless it brings with it opportunities, and I'm very hopeful that it will bring us opportunities for our populations, but it means that we've got to work differently too as an organisation, and the board will need to adapt and adopt that, and Christian is on to that with others too. But it would be right not to mention that, and of course, as we go through that journey, we'll need to bring information back to help governors to understand with us how that governance aligns, what it means for us, and as important as ever is that sort of public impact, which of course it's there to do. So really optimistic about it, but there's a lot of work that we need to all get our heads around. So those were the areas that I wanted to mention today, Krishni. Some really good opportunities, some really good progress, and some really concerning areas that are requiring a lot of attention, and that's the staffing piece, which of course is always the case, but ever more so at the moment. Thank you.
Thank you very much, Angela. That's really helpful. And I think Angela's mentioned, you know, the implications of the ICB for us and for, you know, for us as an organisation, but obviously the council and the board. And I think it links well to what Fiona was saying about the draft, the draft code of governance, and that was under review, but will be finally published. I don't know exactly what the date for that is, Fiona. It hasn't actually come back out after consultation, has it? Yeah, but certainly one of the things we'll want to do is sort of share more of that with you, because that's part of helping us to adapt to this new environment that the establishment, the legal establishment of integrated care systems has obviously meant for all of us. So are there any questions on anything that Angela said, or in any of either my report as chair or Angela's report as chief executive, which were parts of the papers that you received? Any questions for anybody? Okay, everyone happy to move on to the next item. One other plug I will make before we do is that I believe that we are planning, which links actually to something that Scott mentioned and also Richard's earlier presentation. I think the patient story that we've got coming to the next board maybe about the crisis house. Am I right in that is confirmed? So actually that's a really nice follow-on to what you've heard from Richard today, and actually what Angela has alluded to as well about the sort of developments in mental health. So for anybody who's able to join our next board meeting, which will be in obviously towards the end of July, or can watch that back, it'd be great if you made a specific note to watch back the patient story about that, because I think that will give you some additional insight into the kind of the patient or service user view and experience of some of the services that Richard was describing. And I'd certainly like to add my own congratulations and thanks to staff for getting things over the line as far as that mental health collaborative is concerned, because I think that's the next. We've heard about all the fantastic developments we've already had, but the collaborative should allow us to step that forward even more by working together with all our partners more formally. So thank you, Angela, for that insight. Okay, the next item we've got on our agenda is the NED risk and assurance topic, which this month we've landed on talking a bit more about our group model with Leicester Partnership NHS Trust, which you all know is a sort of well-established relationship that we now have. And I think we've had some feedback from governors. It's certainly something I know we've spoken with some governors about in non-REM, that'd be really useful to understand more about how that developed and how we're working together. I'm particularly conscious that some of our newer governors may not have been around actually when we started the relationship with Leicester Partnership. So we've thought it would be a really good opportunity to explain more about it, bearing in mind that Angela is actually joint chief executive as well. Chief Executive of Leicester and indeed Northamptonshire Healthcare. So Maria's going to lead us through this. So if you're ready to go, Maria, I'll hand over to you.
Thanks very much, Krishni. So I've got a few slides to talk governors through. So if I think Richard's going to be the slide maestro. Thank you. So yes, thank you very much, governors, for asking for this to go on your agenda today. It's really good to have an opportunity to talk to you about how the group model is working and the journey that we've been on from an NHFT perspective. And the reason I'm the NED giving the presentation today is because I'm on the governance arrangements with the Leicestershire Partnership Trust. Myself and Krishni are the non-executives on what's called the joint working group. So that's why I've got the honour of being able to talk to you about that today. So if we go on to the next slide, please. So a little bit of background in terms of how did this develop. So I think governors will be very familiar now with us talking in governor meetings about how across the NHS, trusts and other organisations are being increasingly encouraged to work together within their health economy, so for us within Northamptonshire, but also across different health economies in terms of the East of England Alliance that we're also a part of. And this collaborative working really is a positive development for us in the NHS in terms of being able to work with other organisations and learn from them. And the group model that's developed has come from that. So in terms of where it all started from, and I can remember being in a Council of Governors meeting when we were discussing the opportunity of Angela becoming the Joint Chief Executive of NHFT and Leicestershire Partnership Trust. I think we were at the Saints, one of our last face-to-face probably meetings, but we discussed that with governors. That opportunity came up for NHFT to support LPT in terms of its development. And we very much saw it as a mutually beneficial relationship at that time. And that's really where this group model has grown from, through supporting LPT in terms of its CQC development journey. I think we've discovered how much we had in common as trusts and how much we both had to gain from working together. So that's where the group model has evolved from. We started with what was called a buddy relationship, which was based on the CQC development for LPT. And then we came to a point where we felt like there was so much mutual benefit in working together, we would establish what's now called the Leicestershire Partnership and Northamptonshire Healthcare Group. And within the group, both trusts remain independent. So we still have our own boards. As you know, for us, we have a Council of Governors, but we have Angela as a Chief Executive across both organisations, and we have some other joint roles, David Williams and Chris both having joint roles across both trusts, and Paul Sheldon. And that's developed over the last few years as we've sort of realised things that we can do better together. If we go on to the next slide, please. So in creating our group model, we've been very clear, and I can say in terms of our work on the joint working group, all the non-execs are very good in terms of holding this test true in all the work that we do. So in anything we agree to do as part of the group model, we sort of challenge ourselves to say, will this benefit both organisations through the partnership working? So is there sort of added value by doing this together that we don't get from doing it on our own? And that's helped to shape the work programme that we do together. So in terms of that joint work, we're looking to see how each organisation will be stronger and more resilient by working together. And I think resilience has been absolutely key for the group model, particularly during the pandemic. There's been lots of benefits of resilience from working together. Also, it gives us the opportunity to strive harder for excellence together and share good practice, so we can go faster and further by that sharing of good practice and ideas across both trusts, the cross-fertilisation, because we have so much in common and so much to learn from each other. In terms of how we work together, we've agreed some joint strategic priorities, and I'll come on to those on the next slide. So we purposefully kind of worked through areas where we felt we could get that added value together. And each of those priorities is led by an executive team member and has a really clear programme of work and a plan underpinning it in terms of what's the ambition, what are we trying to achieve, what are the deliverables. So it's very much a programme management approach taken, where we're clear what we're trying to achieve, so that it's not a talking shop, it is very much a delivery mechanism for improvement in our services. And as I said, the governance of that is a joint working group between ourselves and LPT, with both chairs from the trusts on the group, and myself as a non-exec and a non-exec from LPT, and also executive directors with joint roles. And then other colleagues join us when they're coming to talk about progress on their work stream. And in terms of reporting back into our board, there's a highlight report provided to the board meeting after the joint working group meetings, and it reports on progress against the strategic priorities. So it is a very focused work programme that shows what difference it's making as it goes along. If we go on to the next slide, please. So in the first year, we had 8 strategic priorities, which you'll see in the white coloured box. And these included innovation and research, so working together to try and create centres of excellence for research and innovation, because this is an area where we've got scarce resource, so joining together adds that extra value. Our work on Together Against Racism, again, something that we both have in common and felt we could push further, faster together, rather than working in isolation on that topic. Talent management, again, learning from each other how to get the best out of our workforce and enable our workforce to develop and progress. Another area around leadership and organisational development, recognising, I think, how important workforce is obviously to both trusts, and trying to share that knowledge and experience to help both trusts to do better and develop the workforce better for us and for our residents. A work stream on governance, again, governance about our work together, but strong governance across the board, learning together on that. Strategic finance, what's the opportunities we've got from sharing information to make the best possible use of our resources, again, to do more for our population. Sharing our knowledge and experience about estates, again, to think about new builds in our environment, and also how we've got a green plan for both trusts, and the quality improvement area, which is where we started from in terms of working on quality together. So how can we build that and accelerate that work as well? So that's been the work programme in the year that's just gone. As I say, in the joint working group, we have very clear deliverables against all of those priorities, and we track progress on those. And we've reflected on our achievement in our last meeting, which was a week or so ago, and agreed to kind of refocus the programme with 6 themes for the year ahead. And you'll see them in the purple box. So a theme around partnership working. Again, as I said, this is a really big area for all trusts, partnership working in your own geography and across wider geography. So us helping each other to develop those partnerships through learning, innovation and digital, the people agenda, quality and safety, sustainability, and the well-led domain. So they're the themes for our work in the year we're going into, and they will be underpinned by really clear programmes of work and deliverables, which we as a joint working group will hold the trusts to account for delivery. On to the next slide, where we can talk about some of the benefits of this way of working. So I think because we're both community and mental health trusts, from hearing from the staff and listening to the outputs from the work streams, there's so much that has been gained from sharing our knowledge, experience and systems, and breaking down that kind of sometimes siloed mentality that you can get within an organisation, that you think you've got to deal with these challenges alone. This has really opens up a channel to a phone a friend kind of scenario, where you can talk to a colleague in the same area but a different patch, share experiences and get new ideas, learn from what's worked well, learn from things that haven't gone so well, so that you can move that agenda forward. And that's helped build confidence within our staff in terms of reaching out to people for ideas, but also trying new things. It's helped to reduce duplication in terms of when we want to try new things, you can lift things from the other trust. We'll come on to some examples of that in a moment. And it also gives staff a reward from feeling that they're benefiting another trust in terms of development and improvement work. And working together, we're able to come up with better ideas through joint problem solving and talking things through, having a critical friend to think, how can we do this better, and solving problems together. So if we go on to the next slide, please. Here's some examples, practical examples that have had an impact on our work, our staff and our residents and patients. So within NHFT's 0 to 19 service, there were some serious challenges around the school nursing service in terms of the demand on the service, capacity to meet that demand, particularly in relation to issues such as safeguarding. So our lead nurse reached out to her opposite number in LPT to talk about the challenges, and LPT had recently gone through a process of revising its school nursing model. We were able to learn from that in terms of things that worked well, the things that hadn't worked so well, and to look at our model and make appropriate changes that are appropriate for NHFT. And that's built a real partnership between those two teams, where they now can talk freely about their work, how they approach it, how they can innovate, and it's cut down the time that it takes to introduce improvement and change, because we've been able to lift things from LPT's experience, like systems, processes, templates, etc., but do take time for staff to develop. And when you're working under a lot of pressure, you don't always have that developmental time. If we go on to the next slide, please. So another area where we've seen a really good benefit is in the organisational development and learning and development team, where we as NHFT have been able to learn from the induction process that LPT have in place. They have a really strong 90-day induction process that's from a staff perspective and from the organisational perspective. And our team in NHFT have been able to learn from that and develop that for our staff. So again, taking really good ideas, short-circuiting processes to help get better ways of working into our trusts by working with colleagues in LPT. The next slide, I think, is an example of that onboarding and induction process. So a really good interactive and digital approach that LPT developed there that we've been able to benefit from. The last slide of examples is around the eating disorder service, and governors will be aware that this children's eating disorder has been under huge capacity challenge with increasing demand within our community, and both trusts are working together in terms of sharing their ideas to help develop this service and make it a better service for children who need support and families, and also for the staff working within that service. So again, talking together, working things through together, benefiting our residents and our staff. On to the next slide, please. So where do we go next with this? So in terms, I said at our last joint working group meeting, we reflected on the progress in our first year of working together. We've agreed some strategic priorities for the year ahead. We want to continue working together as two separate organisations, but linked through our group model that provides that structure and rigour around our joint work together. So it's very purposeful joint work. We want to build on the success we've had with joint posts that enable that sharing and provide that environment and culture for working together, and to continue to make more of the benefits and shared experiences we have as NHFT and LPT. And just in terms of sort of concluding remark for this, I think the reason why we've been able to do so well as a trust in this area is the culture that exists within NHFT and existed right back at that time when Angela became the joint chief executive. We've got a very open sharing and learning culture. So working in collaboration with another trust has come, I think, is very something that's culturally right for our trusts and our staff. And this has helped build that culture. And this is exactly the kind of collaborative working we need across outside, reaching out from our organisations into others to do better for our population. So it's been a great, I think, experience for the trust to learn with the relationship with LPT, and you can see it being replicated in our other collaborative relationships. So I hope that's helpful for governors in terms of a summary of what the group model is about, how it works. And I'm happy to take any questions, but also I'm sure Angela and David and other colleagues who work across both trusts would also be able to provide any answers for governors.
Thank you. Thank you, Maria. That's really helpful. Kind of really clear explanation of the journey that we've been on and the focus that we've had in terms of working together. And I just wanted to add, as Maria rightly said, you know, this has been a sort of learning experience that we've built on in terms of other collaborations. And of course, some of the learning that we've gained from this, we've then taken on to our relationship with St Andrews, which you have also heard about. And albeit that's not an NHS organisation, that the learning experience has similarly been a two-way and shared experience with St Andrews. So thank you for that. I think there's a question, so I'll just a couple of questions. I'll bring in Helen first. Helen?
Thank you. It was really interesting to hear how the relationships developed, because I do remember the start of the buddy relationship and wondering how it was going to pan out and hoping it was going to go well. And I'm just interested to find out if there are any plans. This is not necessarily a question for answer now, but really just a query. If there's any plans to feed some of those specific experiences into the development of working relationships within the ICS across Northamptonshire, if there's some specific experiences or good practice examples which are going to be able to inform and develop how the ICS works, because we have an input into that.
Thank you, Helen. Really interesting question. I don't know if, Maria, you want to comment on that, or whether I can see David. I wondered if David might want to comment. So shall I bring you in, David, and anyone else can add to that? David?
Yeah, by all means, unless, Maria, you were about to jump in, if it's okay. Helen, thank you. I think it's really helped our collaborative work in the ICB, in that we've got a really good understanding that we can then help people realize how you can do it, how work with different organizations comes together. We've got practical examples of how it all works, and that gives confidence to our ICB as a way of working and taking things forward. So in the conversations, they are using the skills and the ways of working that we've had with LPT in order to plan actually how do they work with other organizations and stuff. So it kind of comes in just all that informal kind of conversation stuff of sharing and talking and developing things together.
Thank you, David. And I think it's worth saying that, I mean, Angela may want to comment on this, but one of the conversations I think that will happen and is happening is, you know, what does it tell us about how you do improvement within the NHS, actually? You know, how do you support other organisations? And I think that's a conversation that's happening more widely, well outside Northamptonshire, you know, where there's trusts and organisations that need support. Is there a way of doing it that feels productive and is mutually beneficial? And I think the approach that, you know, we've been able to take has illustrated that really well. So Angela may want to comment on that, but I'll bring Matt Golby in first, Angela, and then I'll bring you in because you may want to add to, you know, and may be able to answer anything that Matt's got questions on. Matt?
Yeah, thank you. And that was really interesting. It's good to learn how both trusts have benefited. And I was just thinking a bit along the lines you were just alluding to there, Christy. How do we remain sure that we're sort of still challenging ourselves and looking outwards rather than just concentrating on a relationship that is obviously benefiting both trusts, you know, in a really good way, but how are we sort of ensuring we're sort of still looking outwards and picking up best practice outside and beyond these two trusts? But it's obviously some really good work. Thank you.
Thank you, Matt. Angela, a good point at which to bring you in.
Yes, no, really helpful. And but I think what Chris has really touched on is this, you know, quality improvement opportunity that this partnership has given us, as well as LPT, because as Maria's helpfully shared, it is mutual, and hopefully examples give you a sense of that. And there's so many examples. We could have spent all day talking to you about that. But the important bit is not only the quality improvement that it does and the climate that we create, but also the learning organisation that we are and need to always be. And as David said, we've taken that into the collaborative learning in our integrated care system, and has informed a lot of that work that I've described in terms of the mental health. But we're also, Matt, just to give you a sense, we're also part of a big partnership in the East Midlands Alliance, which is, again, a very similar model where I'm able to chair all of the CEOs coming together across that East Midlands mental health network. And through David and others' work, we've been able to sign a collaborative agreement. You know, we don't want to be one organisation. We want to actually attract resources into the East Midlands footprint. We want to improve our population health. So we work together on forensics, we work together on child and adolescent mental health, adult eating disorders, veteran health. These are examples where we are going beyond, but it's partnerships that are taking it there. So we're not containing it to this organisational relationship. This is clearly important to us, but it is not the only one. And St Andrews is another example where, as you say, we're supporting, and we're doing that in an East Midlands Alliance way, not just with NHFT, but we're also learning from St Andrews. That is certain, because again, these opportunities give us a real opportunity to say that learning organisation, because you never can stay in the same place, and you've got to keep improving for the people that you're delivering for and being able to benchmark. And of course, we do that on a national basis as well. So there's lots of different ways, not just this one, that do that. But I think what we've attracted is a lot of national interest now about this as a quality improvement methodology, because in the past, it may have been a much more performance-focused approach, which didn't necessarily deliver. So it's something that is being explored, and I think credit to everybody who's been involved in it, because it is about creating a culture and a climate which many of the people involved have contributed to significantly, and I can thank them for doing that.
Thank you very much.
Thank you for the questions. I'll just make sure. Yes, I think I've captured everyone. David Jones has asked, is somebody tasked with writing up the methodology and experience? Well, I think, Angela, you've reached out to the new Chief Strategy Officer, haven't you, to try and sort of capture the approach. So hopefully that will be part of it.
You know, as people are talking about it, and we see that, you know, schools environments, it happens, does it? You know, people buddy up, etc. But it hasn't been formalised as within the NHS in the way that we've done it. But interestingly, it's coming up more and more as a way of going forward. So I've reached out to say, actually, we're doing it. Come and have a conversation with us, as well as I think David's got some opportunity to share case study examples as well. But you're absolutely right, David. It needs to be captured in that way. Thank you.
Yeah. And just before I bring David in for a final comment, David Williams in, I was just going to say also that I think there is a, you know, in addition to sort of trying to capture, you know, this particular approach, it might be helpful at some point if the council feels it would be you know, a useful additional insight is to talk a bit more about the East Midlands Alliance. So what we've been doing, I think, is sharing with you, here's a local relationship we have with Leicestershire Partnership. We've certainly talked to you about St Andrews and how we're working with St Andrews. There's also this larger footprint for specialised commissioning, which is the East Midlands Mental Health Alliance, and that's working on an even bigger scale. So actually, I think hopefully what these things will illustrate is the different ways in which this organisation as Northamptonshire Healthcare is collaborating both within Northamptonshire and you know, on a bigger scale or outside of Northamptonshire, or really ultimately with a view to improving the care that we can provide and learning from others. So it's a really important part of the way we work, I think, and the way we need to work to demonstrate that we are maintaining that sense of continuous improvement. So final comment from David.
Lovely. And David Jones, your comment in chat is perfectly timed. What I was going to say to you was in the CAMS collaborative, so the work we're doing across the East Midlands, one of the things we said was right at the very beginning, we wanted to invest in some academic research to work with us in order to track the changes over the longitudinal time of bringing a collaborative together and seeing how we are, to prove that collaboratives are making a difference and taking things forward. So we're in year 2 of working that through at the moment, and that's starting to build an evidence base then of how people are seeing different behaviours, ways of working and things. So there's an example adding to the points Angela made just a moment ago.
Thank you very much, David. Now, I'm really conscious that I promised you a break, and we've got a private meeting for council starting at 7. So I'm not aware of any other business, so I'm going to bring the meeting to a close. Chris, very briefly, if you could.
Yeah, sorry, I did, and it's not necessarily out of left field. It was something I was going to raise under Angela's report, but conscious of time, it's not. I'm not looking for an answer, but in Angela's report, she talked about the Institute for Public Policy produced a commission on health and prosperity, and I did attend that launch, and it was really interesting about economic health inequalities, which, you know, the pandemic has, if you like, shone a light on. Today, there was an announcement about what they call the left behind neighbourhoods in England, of which there are 225. And there are certainly 2 in my constituency, Avondale Grange and Kettering, Kingswood and Hazelmead and Corby. There's also Queensway and Wellingborough. And the deprivation, health inequalities, population health agenda, which we talked a lot about tonight, actually, in terms of the ICS, I think it would be really interesting to know where in the ICS this will now sit, and whether NHFT will actually, if you like, have a particular response to these issues. It's a bit out of left field, my apologies for that, but it is relevant and it is timely, and that this was announced today, because it does, in my view, hit exactly at the right issue about if the NHS is going to be an anchor institution, how will issues around health inequalities, population health, deprivation come together, and what will the response collectively be? So I would ask for some further consideration of that, please, and some feedback at a future meeting. You'll see some press coverage of this later today. Thank you.
Thanks, Chris. Angela, do you want to make a really brief comment on that?
Yeah, just quickly to say that even the collaboratives, they might exist at county level, but they're successful about health inequalities at local level. And that is something we are talking about in the collaborative. So that will also be visible, Chris. More to come on that, but helpful thoughts. Thank you.
Thank you, Angela.
Okay, thank you very much. And obviously that key relationship with the ICB, obviously a key duty of the ICB is on health inequality. So we shall take, we can reflect on that a little bit more, Chris, and think about how we loop round on the question that you've raised. I just want to finish on a really, I alluded to this earlier, but I made a specific point of going to find the tweet because I was very proud of this tweet. So this was the comment made on Twitter by one of the individuals who leads the positive practice in mental health, and he had just met with some of our team and heard about the work that we were doing with Northants Police, and he said just seeing some groundbreaking and innovative work between Northamptonshire Healthcare and Northants Police. And we need a learning event on this so we can share this more widely. And I just remembered it because I was really proud when I read that on that day, because it's always lovely when external independent people actually recognise the work that your teams, our teams, people like Richard are doing on the ground. So I just thought I'd share it because I alluded to it earlier. So thanks everybody for your contributions today and to this public meeting. So let's give ourselves a 10-minute break, and then we're into the private meeting with Council of Governors, obviously, and specific non-executives who are involved in that. So thanks very much, and see you shortly at 7 o'clock. Thank you.
Take care, everybody.
Thanks, everyone.
Bye.
Bye.
Bye.